We'll hand over to Tracey Carr. Tracey works as a consultant to several leading healthcare companies and as an advocate for better healthcare for plus-size patients. She has developed seminars on maintaining dignity of care for the supersized, which she has delivered at a wide range of hospitals and clinical training establishments across the UK and Europe. In addition, she works as part of a team delivering training in the moving and handling of plus-size patients. Tracey will be speaking from the patient's perspective, giving her personal experience as a receiver of care.
Hi everybody, my name's Tracey Carr. I'm here to give you a personal experience of what life is like for a plus-size patient. I'll tell you a little bit about myself. I'm 53. At my heaviest, I was 242 kilos, 38.5 stone. Currently, I'm about 175 kilos, which is 27.5 stone. And when I was born, I was 3 kilos, which is 8 pounds. So I've kind of been everywhere in between. My background is very boring. I had a very ordinary childhood in a very average size family. Lots of outside activities. I was pony mad, lots of home cooked food, no junk, no fizzy drinks. I was average size. So now I work as an office manager. I also lecture part-time at university, talking about bariatric studies, helping nurses, doctors, physios and OTs to understand a little about how it feels to be very large. I also help companies develop new products, R&D, consultation for bariatric products. I film training videos and I talk to people like you as an advocate for bariatric patients. My life is very boring. I work full time, I pay tax, I vote, I look after my home, my garden, I drive an ordinary car. I'm somebody's daughter, somebody's sister, somebody's co-worker. I have a long-suffering partner, and it's all very ordinary until it comes to accessing healthcare, and then life tends to be complicated. I'm not an advocate for being large in itself. I wholeheartedly don't recommend it, but I think we've all got to do the best we can to fight discrimination, to seek equality of care, to achieve the best outcomes for our individual patients. But also it's important as a society as a whole that we recognise that we're all different and we all deserve equal respect and dignity, and particularly dignity of care. So one question I get asked quite a lot is, how did I get so fat? People don't usually word it quite like that, but it is a valid question. So having grown up in an average sized family, I had mild depression starting in my late teenage years, some comfort eating, some tendency towards obsessive compulsive behaviours, and I gained some weight until I was about 18 stone, about 115 kilos. Life was normal. I played badminton, I played rounders, active, busy. But at age 30, I lost my partner in an accident, and my life kind of spiraled from that point. So I ended up with clinical depression. I was an IT project manager. I couldn't work for 2 years. My obsessive compulsive behavior was out of control, and I gained a lot of weight very quickly. After 2 years, I returned to work, but life was very difficult, readjusting to everything and to losing my partner, and I continued to gain weight until at my heaviest I was 38.5 stone, and life at that size is very difficult and very tiring. So how does it feel trying to negotiate life at that size? Well, I guess the obvious thing to say is you feel very visible. I can't hide my, so to say, condition. I can't pass. I can't dress differently to disguise it. So you end up in a position where your life and your life choices are judged by complete strangers on the street. I'm seen as lazy, stupid, uneducated. I'm seen as a drain on the healthcare system, probably a drain on the benefit system as well. The media paints me as lazy and feckless, and sort of suggests frequently that I'm willfully damaging the NHS through my greed and my lack of willpower. And that's quite a lot to carry around with you every day. Every time I'm seen in public, I'm judged, whether that's a supermarket queue, wherever. I'm very aware of people's judgment and whispered comments and sideways glances. And one thing I would sort of say to you is, like, when I'm stood in a supermarket queue, I could be stood next to a functional alcoholic or a weekend drug user. I could be next to a tax defrauder, a drunk driver, a child or animal abuser, and none of those things show on the outside. They're all hidden and inside, but my crimes, my bad habits, my situation is visible for all. So that's how it feels. You feel very visible, very defensive, very vulnerable, really. You know, I've had incidents in public. I've had somebody spit in my face purely because I was fat. I've had somebody follow me around a supermarket and who actually accosted me and took things out of my trolley. And my other half, who is tall and slim and thinks green food is green because it's gone off, not because it's a salad. The pizza that the lady took out of my trolley was for him, not for me. But of course it was quite a distressing situation, and I abandoned my trolley and went home without shopping, and probably didn't venture out again for another few days. Most of the time I can deal with it. Sometimes I can't. I try to be charitable and to be sympathetic to the people who judge me, but yeah, some days I don't. Some days I don't cope. And you know, at the moment I'm trying to lose weight. I exercise, I do my steps, I wear my Fitbit, I eat the rainbow, trying lots of different colours, trying to eat raw food, unprocessed food. But if I have a really bad experience like that in the supermarket, then my obsessions resurface. The self-soothing behaviour, which for me is comfort eating, resurfaces, and it kind of goes back to square one. When you're bigger, lots of people will abuse you and dress it up as concern. They're just worried for me, you know, a complete stranger that they've never met before. And fake sympathy is one of the hardest things I find to take. But I try to be brave. I try not to take it home. I try not to let it impact me. But every word, every comment does have an effect. And I'm lucky that I'm fairly self-confident. But somebody with less confidence, it can make the difference between them choosing to withdraw from society altogether. Something else I'd say is, unlike an alcoholic whose health improves the second they stop drinking, or smokers when they put out the last cigarette, their health automatically improves, weight doesn't just disappear. When I'm on a maintenance diet and I'm eating 2,000 calories a day, my weight stays exactly the same. The problem doesn't go away. So to resolve my health issues, I need to actively get into a calorie deficit, and that's hard to maintain for days and weeks. But when you're looking at maintaining it for months, years, or maybe even in my case decades, it's a lot harder. The struggle goes on, but it's a constant one. So I'm very lucky. My health is generally very good. I have normal blood pressure. I'm not diabetic. I'm not pre-diabetic. Being big is exhausting, but I think, or I'm told by all my middle-aged friends, that we're all in the same boat, feeling knackered all the time. So about 2 years ago, I had my first real run-in, I think, with the healthcare in an acute setting. I was breathless at home. It came on over the course of a weekend, and the house was being decorated, and I assumed I'd maybe got an allergy to the paint. I went to my GP on an emergency appointment, but it turned out I had a pulmonary embolism, a saddle PE sitting across both lungs. We don't really know what caused it, but it was possibly due to a long haul flight. So I had 3 weeks in hospital. I was stuck on a trolley for 11 hours while they tried to source a bariatric bed for me. When they found a bariatric bed with a inflatable mattress, I watched, slightly bemused, as somebody tried to persuade me to get onto it when it was upside down. It happened to be a product I was familiar with, so but if I hadn't been aware of the product, I would have been put on the bottom of the inflatable mattress. I didn't fit in the CT scanner, so I had to wait a few days while it was arranged and then transported by ambulance to a different CT scanner to come back. It was an interesting experience, but you know, I'm very grateful for the care I received. There was no specific rehab though, so after 3 weeks of more or less constant bed rest, I had deconditioned to quite a significant extent, and it took me a very long time to feel that like life was back to normal. Then more recently, 18 months ago, I had an epigastric hernia quite high up in my diaphragm. In the 18 months, I was admitted 9 times for inpatient pain relief because they told me I was too heavy to operate on. Finally, in August 2020, it got so bad that there was no choice, and I was an emergency admit. I had a repair, I had mesh inserted. Obviously, because I was an emergency, they didn't have a lot of time to plan, but the bed, etc., was all in place very rapidly, which I was grateful for. There was a couple of incidents that stand out though. While I was waiting for the operation, I was on the trolley waiting to be transferred to the table. The nice anaesthetist had explained everything, and I was, you know, just about to go under, and there was a big delay, and one of the nurses actually said to me, "Oh, we're trying to find a way to transfer you from the trolley to the table." So I said, "Well, I can do that myself," which confused everybody, because I think just by looking at me, they judged that I was, you know, not mobile and active. So yes, with a bit of help with the drip, I was able to just transfer myself to the table. But if I hadn't, if the nurse hadn't mentioned that that was the problem, I probably would have been, you know, had my operation cancelled or been hoisted or something, just because somebody wasn't communicating properly with me. And whether that's they were worried about offending me or what, I don't know. But it was kind of yeah, chastening experience. But I was quite lucky. I had quite an interested physio who helped me work on rehabbing me and getting me up and about again before I was discharged, which was great. Discrimination is a hard subject, and sometimes in healthcare, every consultation, every encounter feels like a battle. I am aware that during consultations I'm defensive, and I wonder if that makes me prickly and oversensitive to deal with. I'm very lucky that I'm confident, I'm articulate, I'm able to do my own research. I'm still conscious, though, every step that I may be up against somebody who can't see past my size. And I worry about people who can't advocate for themselves and how their healthcare outcomes are affected by that. One of the issues with being big is that every conversation you have, the person you're talking to brings their own experience of food, their own experience and issues of difficulty, with their own weight, and they bring that to the conversation. So if they are of average weight and able to maintain that easily, then they sometimes don't understand my situation. If they battle hard with their weight and keeping it under control, sometimes they don't understand why my issues are so much worse than theirs, and there's a lack of sympathy. I think, I'm very grateful for the chance to talk to you all today, and I would say kindness and understanding that people come in all colours, all shapes, all sizes is the key to providing dignified care. The United Nations Declaration of Human Rights gives me freedom from discrimination for colour, creed and religion. And it doesn't say only if you're thin. My rights are the same as everybody else's. So you may not be able to imagine how it feels travelling through the world at this size. And as I said, I absolutely don't recommend it. But I would say, imagine maybe that I'm your loved one. I'm your daughter, your mother, your sister, your auntie, whatever, and try and encourage yourself and to encourage your staff to treat me as you would like to be treated. And I'd also say call out discrimination and prejudice when you see it. So be an ally, and the first step to doing that, to achieving that, is to attend training sessions like this and to engage in these conversations. So thank you so much for caring about the subject, and thank you so much for listening to me. I really appreciate that I had the chance to talk to you today. Thank you.